it was a Cadillac. It was like, holy cow, look at all the space, look at all the things you can do with it. And when we first looked at the building and looked at all the challenges of the building, we thought, well, we'll never be able to afford this or never be able to have it come to fruition.
I came the first time when this was an open building, and I said, oh my God, it's so dark. But all the windows were covered. I said, how are they going to pull this? When we opened this place, it was such a change, with the light. It's just the size of the space.
There's 56,000 square feet of space here that hadn't been utilized to its fullest extent for a long, long time.
We had a lot of comments on, wow, I had no idea this was here. I had no idea how pretty this was.
So I started working with Family HealthCare Center back in 1997. From the get-go, they were looking for space.
We had maybe 2 exam rooms to each provider, and ideally you kind of want 3 so that you can keep the patients moving and keep the flow going well. So we had a lot of times where we had patients waiting in the lobby just to get into an exam room because we'd have them all full.
The dream of actually being able to expand and get into a better space had been a dream for many years. The board and the CEO at the time just started looked for a long time, looked at a lot of property, and then this was available.
The original easterlymost building was a car dealership, a tractor dealership. Then it was a printing office, so they had large printing machines on the floors. And then the other portion, which is the westerly portion, which was really the part that was in the toughest shape because it had been a hotel at one time.
Walking into the Pence building was, you can imagine your typical, scary movie. This could have been the site.
I give it credit that our consultants came in and Patricia Patron worked very hard with everybody, and through what I call inventive engineering or financing, we were able to come up with a way of getting this building, and it's a great repurpose of a building.
Kilburn Group along the way was able to assist in that process because, Family HealthCare being a nonprofit, there's not a lot of funds to, fund architectural services and contractors. We had to pull the old 1960s facades off the fronts of the building to get a better look at the historic integrity of the building. And to be able to team up with a great organization like Family HealthCare to make the project a reality was a really good fit.
It really set that foundation for us to grow. We've been able to increase our capacity of clinical teams.
So we went from 13 exam rooms in our old building to 33 in this building.
To me, healing, that's what we do. In healthcare is we try to heal people. A lot of things what we do in primary care is relationships. So when you have windows and light and quiet space, it's much more inviting to have a relationship and talk about the family, the struggles, and the medical conditions too.
So I was just having this conversation with the guy before I came up here. He said, everybody on the street now knows this is the place to come. It is a place that they all respect as their space, as a safe place for them to go, that is beautiful and clean and doesn't look like a poor person's clinic.
Well, anytime you can preserve a building of this age, it gives you history for the community. I'm proud to look at what it is and what it's become.
I believe that healthcare is an act of love. I always believe that since I was a kid. So most people you are adding mission-oriented work will tell you that you become a better person every day. If you see life as a path of being a better person, this is the right place.